One area on the leadership compass that I wanted to take a deeper dive into was managing conflict. I think this is an area that I need to continue developing throughout my PT career. I currently I don't have the best skills on managing conflict, especially in the clinical setting, just because I feel like I still need to work on that leadership aspect. So when looking at the resources, one of the first pieces of advice they give is to embrace the conflict. So I think this is a really important part that I still want to work on, because usually I want to stop and think about it for a little bit, make sure I'm acting appropriately. But sometimes a situation or a conflict needs an immediate reaction, and my ability to give that reaction and give it appropriately is something that I want to work on. And then next, it just says to validate the patient or the coworker's feelings, and this is a way that I think will just help for to like dissipate some of the high emotion that may be in the room, and being able to do this effectively is something that will be a vital skill, especially just working in whatever setting. And then after that, making sure to be listen and to just feel make the person feel safe and comfortable talking to you about whatever the issue is. And then the last piece of advice that they gave was to be quick to forgive. Out of all of the advice, I feel like this is something that really is emphasis, because especially in the clinical setting, being able to forgive a coworker, a patient for whatever's going on, is so important to make sure that you're keeping a positive relationship with them and make them feel like that they're safe. They should still feel comfortable with you even if something goes wrong. And being able to keep that relationship will be vital to just becoming a good clinician.